this is Muhammad Nishad, Occupational Therapist from Begumpet Facility, Pinnacle Blooms Network. Today our topic is disability and types of causes which lead to disability. And along with me, a co-therapist, Memuna Fatima, is along with us.
This is Memuna Fatima, Occupational Therapist from Pinnacle Blooms Network, Begumpet Facility.
So what is disability? So disability is a physical or mental condition where it leads to like a restriction of movements in physically senses and also the restriction of activities. So what are the causes which lead to disability? Like some of the causes are like immediate person who is already having autistic in the family history, and genetic mutations and syndromes, genetic disorders, and being born to elderly parents also lead to any disabilities. And metabolic imbalances or exposure to the metabolic or toxins. And one of the main causes like marital history of viral infections. Okay, some of the causes which are during the birth of a child or during or before the pregnancy, like illness during the pregnancy or after or before birth, and addicting to the drugs or alcohol by a mother during pregnancy, and the prolonged labor, which also lead to disabilities. Premature born or any uterus, the poor growth in the uterus is also one of the cause of ill disabilities. And the other causes like to the mother during the pregnancy are like injury during traveling, mostly like traffic accidents, any occupational injuries like any violences or any conflicts, falls, or anything that leads to injuries. And some of the causes are like mental health problems, which lead to retardation of mental illness, which called mental disability. And one of the causes before or after pregnancy is like poverty and malnutrition. Poverty is the biggest cause of disability, where some of the other causes like nuclear accidents, poor access to health care, and there is not taking a proper medications which are prescribed or any unknown prescribed injections, dangerous conditions at works, that leads to disability. And some of the disabilities, like the list of disabilities, we can take like a different types of disabilities like vision impairment, deaf or hard to hearing, and some of the mental conditions intellectual disabilities, acquired brain injuries, autism spectrum disorder, and physical disabilities. Delayed language is one of the disability. The conditions where we can see a disability like a delayed cognitive or learning skills, hyperactivity, and epilepsy, seizures, disorders like unusual eating and sleeping habits, like gastrointestinal issues like constipation, unusual mood swings like emotional and reaction, like not behaving properly in society. That all are like the things which we can see in a disability care. So, like the risk factors, what are the risk factors during pregnancy or before birth? We can stop is like after 21 and the age of 35. That is a good time to conceive or a plan for a child, which may reduce the risk of autism or any disability. And the parent who is the male parent should be like same age of a mother or elderly to the mother. The age difference also matters. And also whenever you are like planning for a baby, just go for a medical prescribed medicines where we can reduce the risk of disabilities. So unprescribed medicine is also not approved, which lead to disabilities. And exposure to the toxins, or avoid the activities like smoking, drinking alcohol, or exposure to the chemically or toxicated environment. So some of the factors like which can be dealt where like pre-birth or before birth, which and some of the tests we can go through where kid can be like stopped from getting into the disabilities. Like there is a test like a patch test during the birth, during the growth in the uterus, where we can use a patch test where we can see a developmental brain development in the womb itself. And in USA, some of the causes they have noted is like a special disabled kid, which leads to autism, ASD, or ADHD are some of the causes, like anxiety to the mother, pain, or any trauma, or any psychological conditions which lead to a disabled child. And some of the causes or any some of the things will be discussed by Maimuna.
So causes of disability. If you are going through a birth, there will be three types like prenatal, perinatal, and postnatal disability. It can occur. So prenatal is like as discussed by Nishat itself. Prenatal is before birth. So before birth, taking care of a mother as well as development of a child within a womb or within a womb. So deficiency of vitamins or deficiency of iron and folic acid deficiency, calcium deficiency will lead to ill development of fetus within the womb. So proper giving proper medication, prescription of medication to a mother as well as proper diet will also helps in development of child within the womb. As well as we have to avoid the mother from getting exposure to the toxic rays. Like when if a mother is prescribed for scannings or the X-rays and all, we have to avoid taking that till 3 months of the development of baby within the womb. As well as whenever the scannings and the X-rays are prescribed or investigations prescribed for a woman, then it should be taken after a month or after 2 months of conceiving. As well as malnutrition, as discussed about poverty and malnutrition. Poverty itself will lead to ill development of a child. Poverty means there are more than 4 members in a family living in a crowded areas, as well as getting poor nutritious food to the woman as well as a baby, and that will lead to deficiencies in the child as well as leading to disabilities. And as we are talking about perinatal is like during birth. During birth, the prolonged labor, as she discussed it earlier, prolonged labor will also lead to disabilities. Like when a woman is giving birth to a child, that the positioning of the body, the positioning of the child within the womb is breech positioning, cephalic positioning in the body. So whenever a whenever a child is coming out, if it is in a breech position, that will also lead to disabilities. That will lead to shoulder dislocations, dislocations of the knees, as well as dislocation of any of the joints or the joints, as well as it will also lead to decrease the supply of oxygen to a brain. That also leads to cerebral palsy and other neurological conditions within for a child that will lead to autism in future. So to avoid all this, we can prescribe for surgery or C-section. We can go for C-section, as well as we can go through an investigations also. And cephalic position is the best position, where the head will be coming out and the oxygen supply to a brain will be good. Then during perinatal condition, hemorrhagic conditions like during birth, if there is a increase in bleeding as well. So that will also lead to disabilities in child also. As well as hypoxic condition I told. And during perinatal conditions, a kid or a child within the womb might have seizures. Okay, seizures or epilepsy causing to some of the neurological conditions. So to avoid all these, we have to go with some of the investigations. Then postnatal disabilities will be after birth. That might be accidents or the infections which will be carrying out in the environment. Accidents is like accidents or injuries will be after birth. Sometimes child due to high fever or due to seizures and all, there will be a low development. There will be a low development of child within. So to giving nutritious food and providing nutrition to a mother as well as a child is of benefit. Sometimes a child will be developing cardiac issues or the respiratory issues. Cardiac issues like the kid will be born with some of the congenital heart diseases like atrial septal defect, ventricular septal defect, patent ductus arteriosus, tetralogy of palate, coarctation of aorta, as well as mitral stenosis or regurgitation or stenosis. So, according to the disease as well, this might also lead to autism. Like if a child is suffering from any of the congenital heart diseases, okay, the parents and the members from the family will be taking care of him a lot. They won't allow him to indulge with the environment. They doesn't allow a kid to go from one place to another place in a pampering way. Though it is a pampering way, but this will lead to disability in child, which will lead to movement disability, senses disability, as well as activity disability. Okay, as well as we are seeing in congenital heart diseases like that, some of the kids will be suffering from respiratory diseases also. So respiratory diseases will be like COPD, like chronic obstructive pulmonary diseases. Chronic obstructive pulmonary diseases include bronchial asthma, bronchiectasis, bronchitis, emphysema. So these are the conditions where it could be acquired or it might be a congenital from birth. Sometimes, usually the common respiratory illness will be pneumonia for the kid. So there will be a formation of gas balls within the lungs, and that will lead to stomach upset for the child, and that will restrict the movements in the body. So to avoid all this, proper medications as well as proper caring of the child is important. So, as the saying goes on, prevention is better than cure. We have to prevent child getting from autism.
So, some of the risks for the autism associated with several perinatal risk factors include advanced like aging either parents, like diabetic parent, or bleeding during the pregnancy, and also the medications, the use of psychiatric drugs in the mother during the pregnancy or before pregnancy, or autism has linked to birth defect agents acting during the first 8 weeks for conception. Through these cases are rare. So please do take care of the mother along with the kid before and after pregnancy, which can be decreased the rate of disabilities in kids. So just prevention is better than cure, and the risk factors you can check on with, and you can go through all this to prevent the disability. So, as we have discussed causes of disability and what is disability and different types of disabilities. So, we'll know one by one, like how can we help that kid with the disability. So, how can we prolong their education or their daily living skills. So, first we'll go with the vision impairment. The kid who is having a vision impairment, so we can deal with the, so we can suggest the parent to go for an eye checkup and get a glasses which suits their eyesight, and also we can give any activities which can be used tactily, like they can touch and feel the senses or shapes, anything which can be used with the hands instead of eyes if their vision is blocked. So the vision impairment, the kid who is having the more urge for the lights and all. So we can decrease them by closing the lights, doing some activities in the dark, and everything which can be decreasing or increasing their vision improvement. So now deaf or hard to hearing will be explained by Mamna.
So, deafness or a hard of hearing for a kid can be improved by giving hearing aids. We can prescribe him hearing aids, as well as we can use different kind of sounds if a hearing sense is involved, that is auditory sense. So we can go with the senses development, like if a kid is over responsive to a sound or under responsive to a sound, we can plan accordingly. So we can prescribe them hearing aids, or we can go with an ILS therapy as well as auditory therapy. So in auditory therapies, what we does is we just confirm whether the kid is over responsive to a sounds or under responsive to a sounds according to the senses. So if a kid is over responsive to the sounds, then we will start with slow or rhythmic sounds to high pitched sounds. If a kid is over responsive to the sounds, then we will start from slow to high pitched sound, and under responsive from high to low pitched sounds. And if kids' mental health condition is ill, then we can ask parents or the caretakers to take a kid to a rehab center, where we can we can develop their intellectually. We can develop them intellectually by giving occupational therapy, behavioral therapy, speech therapy, as well as to develop the intellectual disability. We can go with special educations in the rehab center. So occupational therapy, there are different types of streams in the rehab center. So each therapy will be dealing with some of the senses. Some therapists will be dealing with the behavioral therapy, and some will be dealing with the speech. So if a kid's mental health condition is if a kid's mental health condition is under consideration, then we can go for all these therapies. In occupational therapy, basically the therapist will be working with the senses, and in the behavioral therapy, the therapist will be working on his behaviors, like anxiety, depression, or the stubbornness what the kids are going through. So depending upon the behaviors, the therapist will be working on. And when coming to the speech therapist, the speech language pathologist will be working on speech. Usually the kids, when comes with a disability, they'll be having delayed speech. So to improve the speech, we'll be going with the speech therapist here. So depending upon the condition, where the kid is over responsive to the things, like repetitions, usually we hear from the parents that our kid is repeating a lot, as well as we'll hear from parents that one word, they'll be hearing a word and they'll be repeating, or sometimes they want to just they point out the things what they want rather than telling verbally. So here the speech therapist role plays an important aspect, as well as to develop the intellectual. If the kid is suffering from intellectual disability, then a special school, they can join a kid into a special school, where according to the kid's ability, the therapist will be what we can say, a therapist will be going with the academic skills. They will improve their academic skills according to the kids involvement. So for acquired brain injuries, sometimes parents will complain that after the kid was okay, ma'am. The kid was okay for 10-15 months, but once he was fallen from the stairs, and after that he stopped speaking. He was not giving good eye contact or eye hand coordination, anything. He was not responding to things what we were telling. So acquired brain injury is like we can develop them. If for this also, we can join them into a special schools, or we can join them into a rehab center, where we are finding all the therapies, as well as we can give therapy to them. So the next to autism spectrum disorder, sometimes what happens is a kid will be having a disability. As I have said earlier, that the kid will be suffering from cardiac or the respiratory or any of the genetic issues leading to disability, that in future might lead to autism spectrum disorder. So to avoid this and or to halt this autism spectrum disorder, the what will be the treatment protocol will be explained by Nisha.
So, as the autism spectrum disorder, that state that like a disorder where all the it is on the spectrum. Okay. So here in autism spectrum disorder, we can see mostly involvement of senses. The eight senses, which is either hyper responsive to the senses or hyper responsive to the senses. So each sense will be dealing with hypo or hyper response. So the kid who is getting low responses, so he will be almost like opposite to that. So just to fulfill their urge, they will be roaming here and there just to calm their senses. So according to the condition of a kid who is hyper responsive or under responsive, so we can design a activity or a protocol for them just to decrease or calm their senses and bring into the norm. So in this, like therapists as well as parents are very important to play a major role in their life. So whatever we are suggesting you to do, like you have to practice at home or you can try at home. So with that, you can just calm their senses and don't give the things which is increasing the urge. Just to just try to decrease or fulfill the urge along with the activity or in a protocol what we have designed. So if we are increasing the urge, that will lead to a severe conditions, and it may take time to reduce it back.
As Nisha have conveyed the message regarding the autism spectrum disorder, as she said, the senses are involved in the body. So the basic questions what parents ask to the therapist is, our kid is always looking at the ceiling fan, or always they'll be rotating the wheels and all. So these all comes under visual impairment. So to reduce the visual impairment or to satisfy the visual sense, we can involve them with the visual activities. So to continuous, as the kid is continuously looking at the ceiling fans or looking at the bright lights or looking at the ceiling itself, how can we reduce this? Is we can design a therapy in a way that he's only concentrating on the therapist or the activity what we are giving. So we can use different kinds of activities, like to decrease visual impairments, we can give we can use swing activities. We can use swing activities along with the upside down positioning of the kid on the swing and giving a slight swing and making him do that activity. And the best therapy for visual impairment will be the dark room therapy. Dark room therapy is like we can use a torchlight within the room, a dark room, or we can use a lamp inside where the dim light will reduces their visual senses as well as helps them in concentrating upon the activity and the therapist sitting in front of them. Either a therapist can continue doing this at the center, and this same activity can be continued at home as well. So these are the basic questions what parents keep on asking about visual impairments, and sometimes they say the kid is usually keeps on running, keeps on jumping at home. So to reduce this, as well as they say the kid is spinning when he's sitting on the chair, he usually starts spinning on the chair. So all this comes under vestibular sense. Vestibular sense will help will disturb the what I can say is vestibular sense can be reduced, or this sense can be reduced by giving them heavy activities or the activities that we can design in a way to reduce vestibular senses, like asking them to do functional activities like bear walking or duck walkings. We can make them do military crawling on the ground, as well as we can make them sit in a squatting position on a box and make them indulge them with different kinds of activities also. So making them sitting on the box and making them do beach posting activity, or we can make them do fine motor skills, like we can make them do play with the sands as well. So here, along with the vestibular sense, we are working on tactile sense also, as well as visual sense also. So this will also reduce both visual and tactile senses. So as it is as senses are involved, each and every sense is interrelated to one another. If one of the senses is getting disturbed in our body, for sure the other sense in the body will also get disturbed. So the major senses which are getting disturbed in our body is vestibular, proprioceptive, visual, tactile, then comes auditory, then comes gustatory and interoception. So to simultaneously, therapists as well as the parents must work on them. And the major question what people ask therapist is the kid is usually going and touching the surfaces. They say they touch the surfaces, they rub the surfaces this way. So any of the surface, we have to ask whether the kid is touching a soft surface or if he's prone to any of the rough surfaces. So they keep on touching or they keep on rubbing their hands or their body or their elbows. They just keep on touching. So this comes under tactile issues. Tactile issues, as well as parents say they keep on touching their hairs this way. So this all comes under tactile issues. To reduce tactile issues, we can use therapies like we can use different kinds of textures also. We can start from soft to hard textures or from hard to soft textures depending upon the kid's response. Like if his response if he is responding to the soft tissues or the soft textures, then we can slowly introduce soft textures for 10 seconds, then we can introduce the hard textures and we can go on, or we can use the sensory kit for them. If a kid is responding to a rough texture, then slowly we can introduce for 10 to 20 seconds a rough texture, then we can prolong that to soft textures also. As well as the best way to control the tactile senses, we can make kid involved in a military crawling. Military crawling is nothing but lying on the floor and asking a kid to move with both the hands and moving the legs. That will reduce the tactile sense in the body and calm the senses down. And as well as some parents says the kid doesn't put hands in the sand or the water or on the grass. So to avoid all this stuff, we can introduce each and every texture, we can say sand. So we can make use of sand, we can make use of water, we can make use of grass in different way, in different activity forms, introducing them this way. So we can calm down their senses as well. So now the question arises is what physical disability? What is physical disability? Physical disability is nothing but a disability that is leading to where a kid is unable to perform their movements or the activities like that. So for example, if a kid is having dislocation, fractures, or any of the neurological ill development comes under physical disability. So to avoid all these physical disabilities, we can use orthosis or the prosthesis that will be fitted on the body, and usage of this treatment protocol also will help in reduction of physical disability also. Uses of prosthesis and orthosis, as well as we can use different kinds of therapies for the better development of kid in the body. So therapy, along with the therapy, here is the major involvement of parents along with the kids. So better understanding between the kids and the child is very much important. So majority of the time a kid will spend with his mother or parents or the family. So it is at most important that parents must understand what children want or their needs in their daily life, and accordingly we can go through it. So this was the webinar on disability and the causes of disability. Hope your questions have been cleared. If any others, in next webinar we will be continuing with it. Thank you.